Sometimes she is like a little girl, like she's going off on a trip now. Right, Dad's going with her, but I just feel I want to hold her because she doesn't know what's in store. She doesn't know what she's going to learn. It's like sending your own child off to school. All I know is that she's hearing this horrible white noise 24 hours a day at a huge volume as well, and it's relentless, it never ceases. And through all of this, she's being a mother, a wife, a colleague at work, all these different social roles, and she has no time for herself really. Even though she's got a brain tumour, the only time she's got for herself is when she shuts her eyes, and then she's not alone, she's got this huge noise. She's very, very resilient, very, very strong.
It's hard to prepare for going deaf because I don't really know. No matter how much you try and plug your ears up, I still pick up sounds and words, and so it's very difficult to realise what it'll actually be like.
This is the white noise that Myris is hearing all the time. Now it's Gareth's turn to hear it for himself.
It is hell.
Yeah, hell. Good, I'll get some sympathy now.
At the Link Centre, Myris learns what it will be like to be deaf. It's here support is offered for the deaf and their families.
I hadn't realised how very, very difficult, stressful and tiring it is for somebody who's lip reading to watch other people. It does make me very nervous and slightly emotional knowing that I am going to go deaf. I'm more aware of it now and how it's going to affect me, and I know I'm going to hit a Great Depression sooner or later. I know that in time, when I'm deafened, that Gareth is going to be put under a hell of a lot of strain because of it. And by coming here, he has a greater understanding of what I'm going through as well.
The tumour has already affected her balance dramatically.
Every time I walk anywhere, everywhere's moving, and it feels as though you're going to pass out all the time. It gives you that feeling as though you're really paralytically drunk, really, that you're staggering everywhere. So when I go into town, I will go by myself, but I would prefer to have somebody with me.
For the last 5 years, Myris has been working with people with learning difficulties.
Open spaces are more difficult than in the house or in work, because the closer into me the walls are, the more I can control my balance. You get satisfaction from seeing somebody perhaps who wasn't able to produce something eventually, with help, being able to produce goods at the end of it, and just to see the satisfaction that they themselves get. That's the good thing, and that's what I feel is, if they're happy, I'm happy. If this tumour causes me to lose my hearing, then I'll probably, I would think, have to give up work. It's not the ideal situation to be working in if you're deafened in one way or another.
I don't know how she managed to do all this in one morning, do you?
Because she just did it this morning.
Once a year, Myris's family meet up to relax and catch up on some family gossip. It's been an enjoyable day, but a cloud of uncertainty still hovers above her. Her eldest son, Sean, has travelled from Cardiff to help with the preparation.
One thing my mother really enjoys is entertaining, and that's what today really is all about. And it is really nice to see her in her element, basically, socialising, enjoying herself, catching up on the gossip, catching up on the news, taking an interest in other people's lives, which is pretty incredible when you consider the pain which she's going through. I mean, mentally, she's such a strong character. She's always been the figurehead, the leader in our family, despite what my father may say. And it's probably hit him harder than anybody else. She's always been his rock.
I really don't know whether this will be the last reunion where I'm here or whether I'll be here to listen to everybody next summer. I don't really know. I'm just thinking of everything as positive for the moment, and yeah, that's life. There.
It's Myris's positive nature that sustained her through the darkest hours. But as time goes by, she's becoming increasingly unwilling to accept the stark reality of deafness. Myris discovers on the internet the prospect of a kinder alternative solution in America. Fractionated radiosurgery, pioneered in New York, could well be the answer she's looking for.
It is a battle, there's no doubt about that. I'm getting much more aware of the fact that D-Day's coming.
Myris comes to Manchester to hear world-famous radio-oncologist Dr. Gil Lederman, who she read about on the internet. He's on tour in the UK.
We started this program, and it's a unique program. It's called fractionated stereotactic radiation, or radiosurgery. And what's so special about it really are two things. One is that we give the lowest dose of radiation worldwide. And everyone knows that if you give the lowest dose, you're going to have less side effects. And number two, we divide up the dose. And by dividing up the dose, it allows healthy, normal tissues around the acoustic neuroma to repair the effects of radiation. In our hospital, we never recommend surgery first. We don't believe it's necessary, and you'll see our data in a few minutes. People with larger tumors do as well as people with smaller tumors. One of the big arguments of many surgeons is that you're too young, why should you have radiation exposure now? Well, the fact is, in our experience, age does not predict anything. And again, I would say the converse. If you're 20 years old and going to have a facial paralysis for the rest of your life, it's a very long time. And I would argue, why not consider the opposite? Try to avoid facial paralysis, try to keep your hearing with radiation. Because of the hot
Gil Lederman reinforces his success rate by introducing patients who have benefited from his treatment in New York. It's a chance for Myris to hear their experiences and to consider if indeed fractionated radiosurgery could actually help her.
It took a long time.
I'm expecting to have an MRI scan this next month. If I get copies of those and contact you and send you those,